Hello and welcome to Homeopathy Simply Explained. I'm Petra Merker, an alternative practitioner for classical homeopathy in Darmstadt. In today's video, I would like to once again explore the exciting miasmatics of the disease CFS and discuss another important medicine with you in this regard. As Henry C. Allen mentioned in his notes, Dr. Wiles states that suppressed gonorrhea in the father can manifest itself in the child as hydrocephalus, capillary bronchitis, teething, diarrhea, or cholera infantum. According to Dr. Wild, in a wasting disease like tuberculosis. Hahnemann attributed many of these diseases to psoric miasma, whereas Dr. Wiles saw a psychotic origin in these diseases, such as vesceral meningitis or cerebrospinal meningitis in children. Also, Dr. Burnett was of the opinion that the diseases rheumatism and gout had a psychotic origin. It was already observed back then that suppressed gonorrhea first affects the central nervous system by impairing its functions. Later, the suppressed gonorrhea leads to destruction in the organism. Gonorrhea is still a very common disease today that is widespread worldwide and affects around 87 million people every year. The disease often has no symptoms. The bacteria attach to receptors on the mucous membrane cells and are absorbed into the cell there. The attracted white blood cells, especially the neutrophil granulocytes, absorb the bacteria which survive in them, and thus further immune reactions are avoided. An infection usually causes urethral problems. If the infection increases, inflammation in the genital area occurs. Eye inflammation can occur in newborns of an infected mother. Depending on where the pathogen enters, inflammation of the throat, including the tonsils, can also occur. Systemic diseases with joint problems, hemorrhagic skin changes, inflammation on the heart, meninges, bones, or tendinitis can also occur. The symptomatology of gonorrhea is important for us homeopaths to know because it is understandable why Dr. Burnett and Dr. Wiles come to these assumptions. When we talk about the psychotic miasma, it takes sense to take a closer look at the medicinal product of Medorrhinum and examine this in relation to the symptoms of CFS patients. The medicine Medorrhinum was obtained from the pathogenic secretions of a patient suffering from gonorrhea. The medicine is often used when the correctly chosen medicine does not bring any improvement or healing, and it is therefore likely that a miasmatic blockade is present. All diseases with psychotic predispositions, such as gout, rheumatism, nerve pain, diseases of the spinal cord, as well as organic damage to the nerves with paralysis, may require the use of Medorrhinum. It primarily affects the sympathetic nervous system, which makes it interesting for us in the treatment of CFS patients. Children who need this medicine are pale or jaundiced, with enlarged lymph nodes, great weakness both physically and mentally, and a tuberculinic predisposition. Various growths such as warts, fibromas, cysts may be present. There is deep exhaustion and severe nervousness. Patients want to be fanned, like carbo vegetabilis. There is a craving for salt and sweets. Overexertion leads to nighttime enuresis. The legs give way due to great fatigue. They are heavy as lead, trembling, and feel paralyzed. There is also a sense of restlessness. The patient experiences worsening by thinking about the symptoms. Exercise, sun, and heat. Driving in a car and getting cold or wet also leads to worsening. The patient finds improvement by the sea and in the evening. Medorrhinum patients suffer from severe memory impairment, are confused, loss of ability to think, are jumpy, are afraid of change, tire easily, and alternate between sadness and happiness. As soon as a time or appointment is set, they become nervous and excited. There is a constant feeling that some danger might be imminent. When they are tired, it is so difficult to think coherently, but it is also difficult to listen and speak. Patients are irritable by small things, such as a slightest noise. Any mental effort worsens. Headaches and dizziness are also part of the drug picture. Sensitivity exists to light, smell, noise, and touch. Even clothing may be uncomfortable and there be temporary numbness. Patients may suffer from infections such as herpes, pinworms, tuberculosis, or warts. The facial muscles may become stiff and painful, making swallowing impossible. The teeth are yellow and there may be increased salivation. Patients can only digest small amounts of food. Cravings or loss of appetite may be present. Nausea may occur when eyes are strained or tired. The rectum may also be weak in excreting stool and the bladder in excreting urine. Some patients also have weakness in the epiglottis, resulting in frequent gagging. The neck glands and tonsils are swollen and there may be shortness of breath due to the weakness, with a feeling of congestion in the chest. Coughing causes the patient to become increasingly weaker until it feels as if the left lung is collapsing or paralyzed. A cold travels from the head down into the lungs. After slight exertion, there is palpitation with a soreness. The neck muscles pull and nerve strength in the arms and legs may be completely lost. With all the exhaustion, there is a restlessness with tremors all over the body. The patients are sleepy but cannot sleep. They yawn a lot, and when they sleep, they hear everything and can answer questions as if they were awake. Once the patients have fallen asleep, they have nightmares, talk in their sleep and thus around. A burning heat may be present in the neck, down the spine, and on the soles of the feet. Patients feel as if they have caught a severe cold, which is accompanied by severe pain in the bones and a feeling of internal heat. At some point during the treatment of ME/CFS patients, a nosode may become necessary, and then tuberculinum and Medorrhinum should be considered. Finally, I would like to briefly compare the nosodes tuberculinum and Medorrhinum in terms of differential diagnosis. As we can see from this table, Medorrhinum mainly affects the spinal and sympathetic nervous system, whereas Tuberculinum can affect all organs, including the nervous system. Medorrhinum suffers from anxiety at night and Tuberculinum from night sweats. Tuberculinum can cause chronic headaches. With Medorrhinum, it is more of a burning sensation in the brain that extends down the neck and spine, but can also be felt in the hands and feet. But there can also be a cold here. Medorrhinum has the feeling of having a severe cold, whereas Tuberculinum has a tendency to catch colds with green secretions. In Medorrhinum, there is a craving that begins after eating, with the craving for salt, alcohol, sweets, ice cream, sour foods, and orange. At Tuberculinum, we find cravings for fat, eggs, smoked foods, ice cream, and spices. Medorrhinum shows weakness in specific regions such as the larynx, ankles, arms, legs, intestines and lungs, whereas Tuberculinum is more general weakness with emaciation. Medorrhinum requires to be fanned and has an improvement by the sea. Tuberculinum improves in cold winds and fresh air. Medorrhinum experiences a worsening of the symptoms when thinking about the symptoms, through slight exertion and through shock while driving. Tuberculinum also worsens when thinking about one's symptoms during mental exertion, eye strain, in closed rooms, when the weather changes, in drafts, and through noise. When we look at the psychotic state and are dealing with ME/CFS patients, we should always focus on the drug X-ray. X-ray can resolve any blockages that may exist. Some ME/CFS patients have to do with fibrotic tissue, be it in the lungs due to a history of COVID or due to MCAS, the mast cell activation syndrome, which can lead to skin thickening or to the formation of exostosis. That means bone growth. X-ray acts on the blood-forming spinal cord and thus influences the immune system at its place of formation. In this way, the autoimmunity that is often found in ME/CFS patients regarding the GABA receptors can also be positively influenced. If we look at the symptoms that X-ray can cause, we can find all sorts of stubborn chronic diseases in the X-ray drug picture, of which ME/CFS is definitely one. With X-ray, we are dealing with combined miasmas, but essentially X-ray is to be viewed as a psychotic drug. Patients who require X-ray are addicted to cold drinks and there is a long period of weakness in the extremities. There is exhaustion that can manifest itself as chronic tiredness with a constant feeling of illness. Patients experience worsening through noises, swallowing fresh air in the afternoon and especially in the evening and at night. Touching, getting up, shaking, pressure and eating. An improvement by lying on the left side, hot water and rest. Eyelids feel heavy and sleepy, and with this medicine my shock theory is also used again, because X-ray has symptoms that were caused by a shock to the nerves. For anyone who hasn't heard my theory on this, I recommended the video ME/CFS, a subacute distributive shock. too few. Patients are sleepless during the day, have difficulty falling asleep in the evening, and often wake up at night. There may also be a pronounced chilliness that prevents sleep and moves down the back. But sweating can also occur. Heart murmurs can also prevent patients from sleeping. In general, sleep is not restful. There may be a feeling of paralysis extending from the spine down into the left leg. The head is empty as if scratched out. Patients have a feeling of fainting that can progress to a feeling of death. The mind is not clear and there may be headache, neck pain or neck stiffness. There may be general lameness and soreness throughout the body and tremors can be present. I hope you got value from this video and look forward to a thumb up or a comment under the video. Don't forget to subscribe to the channel. I look forward to seeing you again next time. Until then, goodbye.